Despite the fact that implant safety has gotten better now in 2023 than it's ever been, there are still potential risks, and it's wonderful that we can find out what those risks are and disclose those risks to patients. One of the risks of having a breast implant is that scar tissue forms around the implant. And that's true of any foreign body that we have. Even a splinter forms scar tissue around it. It's a way the body walls things off. In some patients, probably around 5 to 10%, the body will put so much scar tissue down around the implant that it makes the implant feel firm and look firm like a ball. That's not something that we try to achieve. We try to achieve a natural look in breast surgery. When a breast implant gets too much scar tissue around it, we call that a capsular contracture, because the scar tissue literally contracts like a wet leather that's shrinking up around the implant and makes the implant feel tight and hard. The implant doesn't get hard. It's the scar tissue around it that squeezes on the implant and makes the implant look hard. What we need to do when we see a capsular contracture, sometimes on the internet they're referring to it now as CC for short, capsular contracture. We need to go back, remove the implant, and either take out all of the scar tissue, it's called a capsulectomy, or sometimes you can just release the scar tissue, like opening up the hem of a dress, for it to expand and allow the implant more room to exist in its pocket. Also, with the patients that we suspect might have this ALCL, that rare potential lymphoma, it's important to remove all of the scar tissue around the implant as well. And that's what's been talked about in the news about en bloc or complete resection or removal of the breast implant capsule. It is very important that you have a discussion about breast surgery with a board-certified plastic surgeon who can give you the full gamut of details on risks and a risk profile of using implants.